Welcome back. The time's now 7:12. If you stepped outside lately, you know that it's hot. I think that's probably an understatement, but it's important that you're safe out there. You got to keep yourself hydrated and out of the sun if possible. Joining us to talk safety tips is Dr. Kirk Bonner with Turo Family Medicine. Dr. Bonner, good morning and thanks for being with us.
Thank you.
So, Dr. Bonner, as we just talked about a couple seconds ago, we constantly talk about this heat and remind people to hydrate, but you're in with patients all day, every day. What's something that you're seeing with your patients this summer as it relates to the heat?
Well, what we're seeing are people that are in the heat for too long due to some activity outdoors, usually sports and other things, where people start getting weak and lightheaded, and those are the signs of heat exhaustion.
So, Doc, we always tell people, and we try as best as we can during the weather reports, after the weather reports, just to kind of slide in, be sure you're drinking water, be sure you're drinking water. But how important is it that people start hydrating, honestly, as soon as they wake up, if not the night before, and when they wake up, before they go outside and get their days started?
In New Orleans, in the heat, and the rest of the country, in this climate, it's important to stay with a lot of fluids in your system, and it's very, very easy for that not to be enough. So multiple bottles of water today, and keep track of how you feel.
Of course, we have kids heading back to school shortly, but in the meantime, they're in summer camp. You have summer sports going on. As far as teachers, coaches, parents, what should they be looking for in themselves, and especially children and smaller children who may not necessarily be able to notice those signs to be sure that you're not getting into a space of heat exhaustion or heat stroke?
Yeah, so any activity outdoors, I recommend that there's a plan in place where the person suffering from heat exhaustion can be out of the sun and out of the heat, preferably in air conditioning, and to prepare for the activity to stay hydrated like we talked about, and also wear clothes that help the body evaporate, because that's our cooling system.
And so again, what are some things that you should be looking out for in yourself and in others?
So heat exhaustion, like the name implies, is exhaustion. Your body gets very tired, very weak. You can start to get lightheaded. And if it progresses, you can start to have headaches and nausea with that also.
And at what point should you be seeking medical attention? Of course, if you can feel like I'm getting a little too hot, I'm getting a little too dehydrated, I should go in and drink water or bring the kids in. But at what point should you seek medical attention, professional medical attention?
So what we see in the clinic and in the emergency room settings are people that come close to, if not lose consciousness, and you can actually have a stroke from heat, and adults especially. Any temperature over 103 is a very dangerous thing. It can rapidly cause medical conditions that are severe.
Well, Doc, we appreciate your time this morning. Just always reminding people, because it's going to be hot here for quite some time, the importance of staying hydrated and paying attention to your body, paying attention to those around you throughout these dog days of New Orleans summer. We appreciate your time this morning.
Well, thank you.